Surgical Procedures Lecture. Surgical procedures in the medical office can consist of anything from mole removal to cyst removal to incision and drainage of an abscess and collection of a biopsy specimen. It is important to be proficient in explaining each of these procedures to patients and preparing the patient and the room. Assist the physician with the surgery and apply the sterile dressing and bandage after the procedure is finished. Everything must be laid out and ready prior to the procedure beginning. There are several different types of surgeries, and the first one we are going to talk about is electrosurgery, which uses high-frequency current to cut through the tissue and coagulate blood vessels. A small probe with the electric current running through it is used to cauterize or burn or destroy the tissue. Holding the pencil-like instrument, the surgeon touches the tissue with the tip and activates the electric current with a switch in which the instrument or a foot pedal. Electrosurgery seals blood vessels and minimizes cellular oozing and bleeding. It is used to destroy granulations and also small polyps. Laser surgery is used to safely treat specific tissue with minimal damage to surrounding tissues and limited scar formation. Incisions of lesions, cauterization of blood vessels, and removal of warts and moles, and also some cosmetic surgical procedures are done via laser surgery. Some surgeries that come to mind that are done by laser are cataract surgery and LASIK surgery of the eyes. It is important and you must be specifically trained to operate lasers before assisting in a laser surgery. The medical assistant's role in laser surgery is to observe the surgical field through safety goggles, keep wet sponges ready, and remove flammable items from the laser's path. Assist with the suctioning of the plume to maintain a clear visual field. Have a basin of sterile saline and a filled irrigating syringe ready for use. Anticipate the need of protective supplies, equipment, and instruments for the laser surgery. Microsurgery involves the use of an operating microscope to perform delicate procedures. It must acquire knowledge of the operation and care of the microscope before becoming qualified to assist in these types of procedures. These types of procedures have expensive and delicate equipment and must be handled with extreme care. Endoscopic procedures typically are done in the gastrointestinal department, and these include devices consisting of a miniature camera that is mounted on a flexible tube with an optical system and a light source that is used to examine areas inside an organ or a cavity. Oftentimes we think of the colon, the large or small intestines, or the esophagus and stomach. Small instruments can be used to take samples of suspicious tissue through an endoscope, such as a polyp. Accessory equipment would be a fiber optic light cable and a light source, irrigators of solution and suction, sometimes a camera, monitor, and printer, and a video recorder. Check all equipment before and after use to ensure that it is working properly. Cryosurgery is a very low temperature probe to destroy tissue by freezing it on contact. Circulating liquid nitrogen in the tip of the probe makes it so cold. This is often used on plantar warts or warts in general to try and get the body to recognize that this is a foreign invader. Cryosurgery is used to treat cancers of the skin, prostate, liver, pancreas, and kidney. Cryosurgery is less invasive than the traditional surgery. Surgical preparation of the patient. The patient needs to know the physiological and the physical support. Make sure the patient understands details about the procedure and that they voice any concerns that they may have. Conduct any blood or urine tests, get the consent form, and gather the current history prior to the procedure. Surgical preparation may include having to shave parts of the patient, using cleansing enemas to clear the GI tract, restrict food, so nothing for 8 to 12 hours prior to the procedure, special bathing instructions with a betadine type solution prior to the procedure, or administering a sedative such as Versed or a anti-anxiety medication such as alprazolam. Vital signs should be recorded, and the patient should empty their bladder prior to being put on the table. Ask the patient to put on the gown, and then you would drape the patient to the appropriate surgical area. Pre-operative instructions. Have the necessary consent forms ready to sign. Give the patient the necessary pre-operative instructions such as medications to be used and special skin cleansing instructions. Tell the patient to bring a relative or friend to drive him or her home after the surgery. This is particularly important if the patient is going to undergo any type of sedative for the procedure. Instruct the patient to leave jewelry and other valuables at home, and call the patient the day before the scheduled surgery to confirm the special instructions that are needed. Informed consent must have the patient's written informed consent before beginning any surgical procedure. The informed consent must outline the risks and benefits of the procedure. Patient must understand what the procedure will be that is being performed, why it should be done, and the potential risks and benefits of the surgery. Alternative treatments, including no treatment, need to be listed on the consent form. The possible risks of any alternative treatment also need to be stated on this consent. After this discussion, the patient either consents or they refuse the surgery. It is important to have documentation of either consent to do the surgery or if the patient refuses. Therefore, if there is a lawsuit, then you have proof that the patient refused. Positioning the patient. Have the patient disrobe sufficiently to expose the surgical site completely so that accidental contamination does not occur during the procedure. Position the patient comfortably and so that surgical site is easily accessed. Skin preparation after the patient is positioned then takes place. The goal of adequate skin preparation for the surgical procedure is to reduce the number of transient and resident microorganisms so that the transference of harmful organisms of the incision site is limited. Cleanse the site with surgical soap or antiseptics. It is also important to shave the area of any hair that may be there. Dispose of skin prep tray and razors. Disposable skin prep trays and razors are commonly used to prevent contamination from patient to patient. Common surgical preps are betadine, chlor prep, or HybaCleanse. These are often used. When cleansing the skin, it is important to start from the innermost point of where the surgical incision will take place and making a circular motion outward.